Okay, everybody, thank you for joining us today. Again, this is Jeffrey at DCEdental. We've got an excellent webinar ahead of us here, and we're glad that you've chosen to join us. So sit tight, enjoy, and listen. We've got Dr. Frank and Dr. Griffin, who are well known throughout the dental industry here. I'll give a little introduction. Dr. Frank, over the last decade, has owned and managed multiple practices, and he is the he has implemented here the NoDrill Implants technique and created the osteoconverter and the PDL abutment. Dr. Frank is a sought-after speaker in continuing education and a trainer. He has addressed thousands of dentists at popular seminars throughout the country. And this is, you know, a repeat webinar from Dr. Frank here. This is his second time joining us with a little bit different info, so we're looking forward to having him. In addition to Dr. Frank, we've got Dr. Chris Griffin, who is a solo private practicing dentist from Mississippi, who started his company, the Capacity Academy, in 2008 to help dentists live better lives with more freedom through increases in practice efficiency and production. Dr. Frank, Dr. Griffin, we're excited to have you. Thank you for joining us, and we look forward to what you've got to share with us.
Well, thanks so much, Jeffrey. Thanks a lot. And I'm honored to be on here with Dr. Brady also. This is a big thrill for me.
Hey, this is great. I've known Chris for 4 years, and more importantly, I've known the dentists who have kind of followed what Chris has done in his practice, which is remarkable. And what's neat about Chris is the guys that he's mentored and helped along. I mean, I've seen just amazing increase in their practices. So it's always exciting to be on the line with Chris, because I know the dentists listening are going to come out of it with a huge leverage on their investment of time here today.
Well, yeah, and let's not forget, you know, talking about mentoring dentists, Dr. Brady actually mentored me. So maybe at some point today we may talk about that process, but I'm not opposed to continually trying to learn and get better, even in my own practice. So it's been a great relationship these last few years.
Guys, you know, we're excited to have both of you here. If I may just remind our listeners real quick that they are in listen-only mode. They can send messages, ask questions, and we'll answer those questions at the end. So feel free to send those in, and we'll answer those at the end. Again, you are in listen-only mode, and we'll get started.
Okay. Well, Brady, do you want to? You know, I know we're going to talk about today. We were putting this together. We were talking about, you know, the ways that we can strengthen everybody's practice, and that's kind of what we want people to get out of this, is the ways that we know will absolutely work to make their practices stronger and more secure. And I'm going to talk a little bit about, you know, what I've been screaming about on the horizon for a while is through no fault of their own. It's just a fact that the way things have been going in America have set this up to where big practices and corporate dentistry and stuff like that are just really booming on the horizon, and how maybe the dentist can deal with that thing that's coming down the line. What would you like for everybody to know to get going before I start off on my little 2 cents?
Well, I guess what I'd like the folks to know here is that dentistry is changing in a big way, and we're just starting to see the first parts of that. I had the unique privilege of being a member of the American Association of Dental Group Practice. So I got to network and talk with the owners of some of the largest group practices in the U.S., Gentle Dental, Bright Now, all those big ones. And I know what their plans are. And so for the private practitioner today, the solo practitioner, to get ahead of the curve means that he can be incredibly successful even with the kind of the onslaught of these corporate dental machines today. But a general practitioner who does not get the information I think that you're going to talk today about, Chris, is really, unfortunately, going to kind of be part of the decline of solo practice and income in solo practice today. So I think this is probably the most important topic today in dentistry, and I know it is because I used to network with all the presidents and CEOs of these big corporate companies. So Chris, I'm just going to let you carry it away, because your stuff is the best stuff out there, I think, for combating corporate dentistry, and then I'll just kind of bring it in on the implant side of things as you get moving along, because I think, you know, niche dentistry, and especially implants today, is going to be what really, you know, bring guys to increase instead of just a slow growth curve. So Chris, yeah, take it away. I'll be listening just as much as everyone else on this webinar because I've been doing that the last 4 years, and everything I put in place that you've taught me has really worked well. So I'm all ears for you, Chris. I'll just enjoy myself here.
Okay. Well, hey, now so obviously everyone heard that. So Brady, he is the inside man that's come out and now he's out. And so if he knows some inside information that contradicts or solidifies something I talk about, then absolutely, just jump right in. But yeah, say go. Yeah, I saw that picture of both of us. That's good. They're both of us are, and so you know, I'll tell you what. If I am qualified to talk about some of this stuff, let me just kind of tell you my little the story. If you don't already know it, is I've had basically I've had every problem or mistake you can imagine in dentistry. I thought I had a sweet deal coming out of school back in the 90s, and I go in with my hometown dentist, and it didn't work out, which, you know, I guess a lot of associateships don't. And so I was in my hometown already. My wife was pregnant, and she didn't want to leave her mom, and so there was nowhere else to work around here, so I was forced basically to start from scratch. And so I got that practice going. It was a long story there, but I got it going in 45 days. I saw my first patient, and I had a nice little practice going. And sure enough, that wasn't good enough for me, so I went and heard some of these speakers talking about these fancy institutes, and I went to one institute. That wasn't good enough, so I went to 2 institutes, and before you know it, I tried to change my practice here in Mississippi, a real blue-collar town, into a completely cosmetic boutique-type practice. Totally fell on my face, nearly went bankrupt with the practice. It was just total, utter failure. In 2005, I managed to get my head screwed on straight. I put together a plan to, really be a good dentist for the people that are here, not the people that aren't here. And by 2008, we had actually managed to go from just a gosh-awful practice to a practice that's triple the ADA national average, and we're down to working 3 days a week as a solo practitioner. So that's kind of my story, and so a lot of stuff we're going to share with you is the ways that I fixed my practice. Luckily, have been the ways that a lot of dentists that I've helped coach have combated some of the problems they've run into when some of these big corporate entities come to town, right? So,
right.
So let's go to that next slide, and we'll see. And so I don't know how many people read the ADA News. Do you read that thing, Brady?
I get it. I think everybody gets it, and I don't really read it real intensely, but I might look at the front cover now and again.
Well, yeah, and that's a lot of us, right? I mean, it's tough enough to read the ADA News with as busy as we are. I mean, that's one of the problems, right? We're so busy. It's just real hard for us to grasp any new concepts. The ADA News comes a couple of times a month, and you got the JADA, which, golly, we should be reading cover to cover, but it's just tough. And so if you didn't notice, in April, big news in the ADA News, dentist net income has been down every year since 2005, every year. I think it peaked at about the average dentist, $217,000 in net income in 2005, and now it's down in the upper 100s. Well, actually, it's not even necessarily the upper 100s now. It's the average. And so it's in a steady decline. At the same time, corporate and group practices have risen 25% in the last 2 years. Now, get your head around that number. I mean, who goes up 25% in 2 years on a scale like that? It's not like a dental practice where going up maybe 25% in 2 years is tough, but it's not impossible. We're talking about, I don't know, I can't even imagine. Brady, you know more than I do. How many dentists are we talking about in group and corporate practices?
Well, it's pretty big. Just in Heartland Dental alone, there is about close to 400 dentists, and they're doing $500 million a year. And I believe that's, you'd have to check on that, but I believe it's $500 million a year is very accurate for what they're doing. So, I mean, this is huge, and they're growing, I mean, leaps and bounds, just like many of the groups out there. So, unfortunately, looking at your statistics, Chris, the solo practitioner's revenue is going down, and group practice is going up in this recession.
Yeah, and so look, so, and I guess it's safe to say there are thousands of dentists involved in corporate and group practice, and there are only about 100 and somewhere between 110, 120 general dentists in America to begin with, and so they're spiking. I mean, this is their heyday. I mean, I don't, and so they're coming at you. I don't know if you're, even if you're buried down where I am, it's only a matter of time before they get down here. Solo practices are down, and I think one of the big reasons that these corporate entities can suck up dentists the way they can is because student debt is also at an all-time high. Another tidbit from the ADA News, if you want to start reading that, you get all kind of little insights you would never, and it, you know, we don't even, no dentist really makes a big deal out of it, but they have statistics in there that'll really open your eyes if you read that thing. So these students coming out of school, I mean, they don't want to, they already owe $250,000. Their wife, you know, they've suffered through 4 years of dental school. If they're married, their wife wants a house. How in the world are they going to afford to open a practice? So they go into these corporate entities, and I'm sure a lot of times the corporations have ways of making them feel good about being there. And so a big skill that all dentists used to have, which was the business side, is just never being developed because goodness knows the dental schools don't develop it. So now they're not even being forced to develop it in private practice. So, all right, so what's our, let's see. So, okay, so let's talk a minute about what kind of advantages the corporations give these people. And this is tough to compete against. So you have these marketing costs that, you know, let's say for Heartland, I don't know how many offices they have, but a bunch. So they can go out and they can hire some real whiz-bang New York, you know, graphic artist and marketing department and stuff like that. They can do marketing for Heartland, for all of Heartland, and they're just charging Heartland one time for that, right? Well, if you try to go for your practice and charge, you know, they're going to charge you one time for that same thing. Well, you can only use it in your practice. Heartland can use it many, many, many times over. So that really cuts their marketing costs down, and they get real top quality marketing. Supply costs, lab bills, stuff like that. I mean, you're gonna usually in a corporate setting be using the lab that they want you to. Sometimes the corporation even owns the lab, and in which case you're definitely going to be using that lab. And they can give better prices than you can get as an individual dentist. I have visited several different corporate entities, and they all have just amazingly well-honed systems. I mean, and I assume, Brady, that's your experience also. Is just everybody that has a big company, I mean, they have certain ways that they do things. Is that correct?
Yeah, absolutely. They've got training protocols. They've got, you know, just, you know, very efficient systems, so they can charge lower fees and have, you know, days that are double or triple the average general dentist's production rate. Yeah, absolutely.
Yeah, and so let's just assume for a minute that you're a dentist, and you think, okay, well, I can do that. I mean, I can go, I can have these amazing systems. I don't see why I couldn't. Well, guess what, guys? The same reason you're not reading the ADA News or the JADA, you know, you put in your time at the office, it's tough. At the end of the week, you're ready to go home. You don't want to go home and contemplate a better way to do things, a better way to cut a crown prep, or a better way to efficiently stock a supply closet or anything like that. Well, these companies, they know the best way. And at the bottom, this is maybe the most important thing, that they have people that can manage the systems for the doctors. So maybe even another thing that's so amazingly attractive for the doctor is, guess what? I don't have to manage this stuff. I go in, I do the skill they taught me in dental school, I go home, and I get paid. And maybe I don't get paid what I could in private practice, but boy, my life's a lot less stressful. And I think that's probably what a lot of these guys are thinking. You know, and I can see the appeal. When I was getting out of dental school, maybe that would have appealed to me too. I don't know. But for those of us out there who already have a practice, I mean, I don't think that's really a great option for us, is to just say, okay, I'm going to quit doing dentistry and I'm just going to go work for a corporation. Just, you know, now, hey, if a big corporation comes into your town and they offer to drop a lot of money on your head for your practice and you want to go into that kind of setting, I mean, that's another thing. But do you really think that the corporations are going to come in? Are they going to buy every practice in a town? Or do you think they're going to come into a town, buy one practice, throw all their expensive marketing and systems and stuff like that at it, and then just try to suck all the patients out of all the other practices around it? I mean, that seems more realistic. What do you think about that, Brady? Does that sound like more likely what they would do?
Yeah. In larger communities like Seattle, some of the groups might have 6 or 7 locations, but they'll spread them out based on the population density. And right now, many of the groups focus on the larger population bases simply because they need associate dentists, and they go through associates. The average associate time period in a group practice is 18 months. And so they need to be in the big population centers to keep their associates in place. But they do know that the rural areas in America are actually lower competition and better for dentistry. So if you're in a big city listening right now, think about the rural areas. That's one area where you can kind of escape to some degree this corporate onslaught, and so that's just kind of what's on the future is more group practices in the bigger cities and medium-sized towns. Small-sized towns, we're pretty safe, I believe, for quite a while, if not indefinitely, just because they can't keep replacing associates in a town the size of 6,000 to 30,000.
Well, that's true, and it's curious to me. It's always curious to me is why so few new graduates really want to come to the country or rural area or just a smaller town. It's perplexing to me. That's been my experience, at least, is that the vast majority of students really prefer to stay in the major metropolitan areas.
Yep.
Is that kind of what you've seen too?
Absolutely, and the group practices know this. So if you are in a metropolitan area and you're listening today, there are the things Chris is going to go over next are the things you'll need to pay attention to really beat the corporate machine. And if you're in a smaller town right now, just putting the things in place that Chris talks about will be even that much more effective. And so yeah, I'm excited to hear, especially about that same-day dentistry and what you've done there, because I know the dentists I've talked to have raved about that. So that's awesome. But
okay.
So how can we compete with these groups, Chris? What do you think we need to do?
Well, I think use a lot of common sense. That's the main thing. The first thing on my list here is the TAC staff costs. I think, and I get emails like this all the time, is people are always asking me about hiring more people. And here's what I find very interesting about these questions. I might have a person that I coach that's doing $200,000 a month, and they have 3 front office employees. And then I might have a person that's doing $50,000 a month, and they also have the same amount of front office employees. And both of them are asking me, do you think I need another person? My staff is telling me that they need somebody else to help them. Now, in the $200,000 a month practice, depending on how the person practices, maybe that's true. On the $50,000 a month practice, it's almost a sure bet there's no way they need more people up there. But I think this goes back to kind of a leadership or a management thing. If you are not paying attention, and your staff thinks that they can kind of run the practice the way that they think it should be run, things are always going to default to the staff thinking they need more people. And so in our practice and the practice we coach, one of the first things we do is we go in and we try to find out who's doing what. So we'll have a sort of a deal where people fill out exactly what they think their job is and all the things that they do, and then we'll review it. And without a doubt, every time, there is tremendous duplication in every practice that we work with in the beginning. So it might be Mary, Sally, and Donna all think that it's their job to put the routing slips on the charts. And so every time that 3 people think it's their job, do you think it gets done 3 times better or 3 times more frequently? Absolutely. What you find is it gets done way less. then if one of them thought it was their job, then it's going to get done. Then you can manage that, you can coach that, and make sure it gets done 100% of the time.
Sure.
But if 3 people think it's their job, no, it's going to only get done sporadically, and everyone's going to be thinking, oh well, let her do it this time, or something like that, and that's the way it is. So we want to make sure that you're actually staffed the way you need to be, because payroll is always going to be the biggest line item on every dentist profit and loss out there, and so you need to make sure that the payroll line item is where it should be. And I'm not going to tell you a percentage that's got to be that way. I've seen very profitable practices at 15% for payroll. I've seen very profitable practices at 30%. A lot of it depends on how you practice, and I'm not here to tell you how to practice, but I'm just telling you, you got to make sure everyone has their job description down pat, and then only hire the amount of people that you need. Another thing we can look at are supply costs. I can't tell you how many practices we go into where people have got their supply bill sometimes is up to 9%. The reason I can talk about people like that is because back 10 years ago, our supply bill every month ran at 9%. And I'll tell you what happened to us, and you can watch out and see, make sure this doesn't happen to you. But every time the dental rep would come by our office, they would have some sort of a new special, like buy 3 get 4 free or whatever it was. And the assistant that I put in charge of ordering supplies, while she was very good at being an assistant, she really didn't understand the business side, and so she always thought it was a better deal to go ahead and buy a bunch of stuff and get extras for free. And so when she left, we went into the supply closet, and I threw away literally thousands of dollars worth of stuff that we never got to use before it expired. I think the sickest I ever was throwing away like 4 tubes of Emperor gum. You know how expensive those things are. And I'll tell you, a comical thing about it is she left in 2002. Well, it was 2010 before we ever had to reorder a number 4 round burr. Because apparently, when we got to looking back in 2002, there was some crazy deal being run, like buy 3 or 4 clinic packs and get a few free, and so goodness gracious, she bought enough number 4 round burrs to choke a horse. And so you just need to have a system, stay on top of what you're ordering every month. I think there's no reason why any dental practice really shouldn't be able to get their actual dental supply bill down to 5% or less. Now, I'm not talking necessarily about, I'm not talking about if you put like repairs and stuff in there, but the actual supply bill. All right, so then let me tell you what the biggest thing I think. So I think you got to make sure that you do not waste your resources, okay? So when I talk about wasting resources, you have staff manpower, you have doctor's time. It's very important. You have the resource of actually the time and effort you spent to get patients into the practice, right? So in my practice, when I found the most profitable thing that we weren't using correctly when I changed my practice style was the fact that we really never encouraged same-day dentistry. And I don't know why, but someone would come in, we'd diagnose them, and before you know it, sure enough, they were not staying for same-day dentistry. We were trying to reschedule them for the next week, the next day, the next 2 weeks, whatever. And so all those things cut way back on the amount of, if you get someone to stay today, if you offer today as an appointment, you're going to vastly increase the percentage of your case acceptance. You're going to make sure that you don't have the cost of turning the rooms over again. Your chair's sitting there all the time is sucking up overhead, and if you do the dentistry today, you're going to utilize more of the time that your office is open and available, and your manpower's right there, right? So there's just no reason to do it. So that's one of the biggest things we coach people is how to do more same-day dentistry. And so that's kind of one of our big deals, and that's one of our big pushes. So
I like that, Chris, and I started kind of following what you were saying with same-day dentistry 4 years ago when you first started talking about this stuff. I'll tell you what, since we first heard you, and I know you teach more in depth on this, and I know you're doing a seminar in Dallas where you'll be actually going over with doctors and even staff how to put together protocols to do same-day dentistry. But just to speak a little bit ahead on that, we started kind of following your protocols, and what we saw was we were doing an extra $5,000 a day in same-day dentistry. And I was working 4 days a week at the time. I work less than that now, but that was an extra $20,000 a week, which is an extra $80,000 a month. My overhead went from about 63%, it went down to 46% by doing same-day dentistry for those reasons you were talking about. So I became a believer after that, and you know, I've been placing implants for over 10 years. So we just put your principles into place with implants, and now on average we do 1 implant a day that wasn't scheduled. So you know, we have a lot of teeth that come in for extractions. We just present the implant, say, hey, if we put an implant right in there, you'll have less of a chance of a dry socket, and we don't need to bone graft it. And
oh, man, that's awesome.
Yeah, so it's just, I mean, it's just been great for us, and I know you'll be giving folks an opportunity to actually get more in-depth information on same-day dentistry, but I just wanted to give you a testimonial about what we were able to do, you know, following your protocols, your staff protocols for same-day dentistry. So, hey, thank you for that.
Oh, hey, man. No, I did not know that till today. I had no idea, but great. I mean, I'm glad. I'm glad I'm glad at least somebody was listening to me. I appreciate that.
Yep. Well, anyway, hey, it looks like you got the 4 pillars of same-day dentistry. Maybe go over those briefly, which is kind of alluding to your seminar coming up in Dallas in August.
Right. So if you're wanting to do more same-day dentistry, I think there's 4 ways that you got to do it. The first thing you got to do is you have to have your new patient experience down pat, where you have just real slick systems to make people feel good, and to also get their financial arrangements done quickly so that you can present treatment. Because if you don't know what their insurance covers or stuff like that, there's no way, right? And also, the new patient experience is a key to getting more direct patient referrals. I really believe that's 100%. The next thing that you have to do is you have to get your staff in an environment where they can succeed. And one of the things we did in 2005 is we sat down and we said, where are our blockages in the practice? Where can we fix this? Where can we get more time? And in the setup room, we went to a totally color-coded system to make it easier on them. In the operatories, we also have a color-coded system, a way that it's impossible to mess up the setup for each room, for each procedure. That's one of the big things we teach in our courses. The procedures, they have to be perfect. When I say perfect, let me tell you what I mean by perfect. I mean when a procedure is set up perfectly, the doctor can walk into the room, sit down, pick up the drill, and go to work. No pauses, no distractions, nothing going wrong. The assistant absolutely gets everything where the doctor hasn't got to think about a thing. And also say we glue the assistants to their chairs, because we don't want them getting up in the middle of a procedure, right? Because that just wastes all kinds of time.
Right.
And then at the end, a lot of doctors will always say, "Hey, Dr. Griffin, this all sounds good, but you know, if I've got same-day dentistry going on and I had a scheduled patient, it's just hard for me to think about more than one thing at a time, and I just don't think that I could do it." Well, we created a doctor focus mechanism. So in my practice and in all the practices I coach, we only want the doctor thinking about the patient in front of them. We think that you owe that to your patient. I think it's very important that you focus on that procedure. And so we created a way that the doctor can just instantly look at a board and tell where they need to go next and what they're supposed to be doing.
Yeah.
Okay.
I've loved that. That's
all
awesome.
right. So that's the 4 pillars. And then guess what? If you really want to supercharge the practice with same-day dentistry or the practice in general, then you have to find cool little niches that allow you to have increased profit. And guess what? That's where Dr. Brady Frank comes in. So you tell him how you helped me find a little niche that made an amazing profit in my practice.
Well, hey, that's awesome. I know you spoke about that earlier. Yeah, I had the pleasure of going actually out to Dr. Chris's practice. And I'll tell you what, he lives by what he teaches. And, you know, I'm not going to go over practice numbers today, but that practice, for you being in there 3 days a week, I don't know if there's anyone else in America doing an hourly production with the fees you have at that level. And I think it's because of those systems. And I know, Chris, you put in your time. I know for 3 years or so, all you did was run around to the top practices in America. Some of them were Greg Stanley's superstar practices. And you kind of made a model out of the best of the best. And I've seen it in action, and, man, it works. But so anyway, it's worked for me. I think if there's any investment of a few hours' time that any dentist should make, it's, hey, getting to know those systems, because they're not just getting to know your systems, Chris. I think they're getting to know the systems of the top 12 practices that we've seen in America over the last decade. So that's awesome. And I did something similar to Chris. When I got out of dental school, I closed on one practice, bought a practice the day I graduated, bought the next one 4 months later, and ended up buying about 12 practices in the first 5 years of my dental career. So I got to go through this huge learning curve, made a bunch of mistakes. But through that whole time, I did do dental implants. And I found out that most dentists are scared to death of implants because most teaching on implants today is taught by oral surgeons and periodontists. And oral surgeons and periodontists, they use surgery tools to do implants. As general dentists, it's a big deal to get out all the surgery tools in between a crown prep and a quadrant of fillings. So what I did is, it's been over a decade now, I slowly basically put together an implant protocol system that allows a general dentist to use his general dentistry tools for the most part and some minimally invasive surgical tools to do implants. And what that does is it allows a dentist to use what he's most comfortable using for implants. Because reality is, an implant should be no more difficult to place than a post in the lingual root of number 3 or something like that. So if you do endo right now, and rotary endo, if you do rotary endo and extract teeth, there's no reason why you can't do a bunch of implants with a lot lower risk than most dental procedures. And so I started my quest of making implants a routine procedure for the general dentist. And you know, Chris is a good testament to that fact. His first day of implants, he did extremely well. I think he saw 5 patients. I flew down there. In about 7 hours, we saw 5 patients, and he placed 13 implants, and just did great with general dentistry tools. And the day was a success. And so we're just going to talk about this secret ingredient to practice success and how that can combat the growing trend of decreasing dentists' income and increasing corporate practice in America today. So anyway, what I teach is no-drill, minimally invasive, efficient implants. And well, I don't know if any of you guys remember Scott Perkins, I believe his name was. He developed what was called the 15-minute crown procedure. Was that his name, Chris?
That was him, and I was one of his first students ever. And
Are you?
I love the guy. Awesome.
Well, so I really learned a lot from him, and I use his gun rack. I know you do too, Chris. So what I developed over time was what I call the 5-minute implant, abutment, and crown procedure. So that's an implant, the abutment, and crown impression in 5 minutes. And so we do that same day in our practice. For example, you know, someone missing tooth number 4, you know, today we're able to anesthetize with septicane, do the osteotomy, place the implant, and take the impression in under 5 minutes. And if you go to YouTube, just, you know, go to YouTube and then put Brady Frank Dentist in there, you'll find some of those videos that I think are up online now on how to do that. But of course, Chris, I'm going to be at your Dallas event in August, and I know we're talking about that more. I'm going to be doing a prerequisite on these procedures at Chris's Dallas event, and so anyway, basically, I teach no-drill, minimally invasive, efficient implants. The case you're seeing right there, that patient needed a bunch of teeth extracted, but he elected to take out number 30 and 31, number 19, and then 14 and 15. So we scheduled him 1 hour to do those 5 extractions and 4 implants. And as you know, can see, obviously there's a bunch of bacteria around the roots of number 14, 15, 30, and 31. Number 19 looks okay. But so this one case is going to demonstrate several of the techniques that I teach. And so this patient, he was completed, he was given a 1-hour appointment. The surgery took about 20 minutes. And basically what we did was took out some teeth, put some implants in. Believe it or not, there's a big myth in dentistry, which is, hey, you can't place implants where a tooth that had bacteria was sitting. You got to wait and let it heal 3 months. Well, folks, bacteria cannot thrive or live on metal, on titanium. There's no substrate for that bacteria to feed on. So these implants that were placed immediately in this X-ray, all, of course, we put crowns on about a month and a half later, and no problems in healing. The infection went away around those teeth. So I'll just go over that real quickly. On that number 19, we actually did not do a no-drill procedure. We used one drill and then the implant right down there, down the lingual root. We tilted it right, kept it right in that lingual socket, and we were putting kind of a little larger molar back there. Upper left on number 14, we did a no-drill implant there. You can see that, it looks like 2 or 3 millimeters is in the sinus. Well, it's not. No drill was used. That lingual root kind of goes around to the lingual of the sinus, so that's all bone around that implant. Number 30 and 31, I did use a drill on those because I wanted to get down below kind of those infected teeth, and so 7 minutes. And so that's a good, fun case, and that everybody on this call should be able to do, after doing a few of the more simple implant cases. So we're going to talk about no-drill implants. I know we don't have too much time, but I'll cruise through some of this stuff. As you can see, the implants that are featured right there, those are actually osteocore implants, and those actually allow compression of the bone and have a taper that is equal to the average of 100 different roots. So they work with pretty much any extracted tooth. So just about every day in our practice, we'll extract a tooth and put one of these implants in it without using a drill. Now that procedure takes less than 10 minutes, or excuse me, 5 minutes. So I teach the 5-minute implant, abutment, and crown procedure, but I also teach the no-drill implant. And after you extract the tooth, the placement of the implant takes less than a minute. You just use a special tool. It looks like a screwdriver, attaches to the top of the implant, and you screw that implant right into place. So what that does is it eliminates the hole left by the tooth extraction. So you pretty much, well, you do eliminate dry sockets, which is great. And basically what the process of osteoconversion is this implant, as it's being screwed into that socket, it basically converts that oval extraction site into more of a cone, much like an osteotome. So it's basically a screw-in osteotome and implant all combined. And so basically when you put that implant in a socket, as you know, that's all cortical bone around a socket, which is much better than not being in a socket. So the success rate is extremely high, about 97% success. And so it's even better than bicortical stabilization because, like I said, the socket is all that type 1 cortical bone. So back to the 5-minute implant abutment crown procedure, which is what most dentists are really interested in. I use what's called a 3-in-1 implant. A 3-in-1 implant basically has the abutment and the lab analog or the lab transfer and the implant all packaged as one unit. You put the implant in, take an impression, unscrew the abutment, and boom, there you go. You send that to the lab. The lab does the rest. They actually customize the abutment, send you back the crown, and you just hold the crown for about 6 weeks while the implant osseointegrates. If you get over 50 newtons of torque, I recommend you just seat that crown anywhere from 30 to 60 days after placing it. And you can go to YouTube. Once you're in YouTube, just plug in Brady Frank DDS, and you can see some of those protocols, and I'll go over the last thing pretty quickly. I want to respect everybody's time, but in order to place a 5-minute implant abutment and crown, you basically have to know these 3 flapless techniques for the basically IAC, implant abutment crown procedure. And so the direct approach is just after it's numb, using the first implant drill and going right through the gums and doing your osteotomy. The high-speed approach uses a special bone drill bit in your high-speed, and then you make your initial pilot hole in the gum tissue and go right into the bone. And of course, Chris actually did that in his practice on his first day of implants. Next one's a mini envelope, which allows us to retain keratinized gum tissue. Next is a finger graft. That's when you're placing it directly in a socket site, let's say number 3 or 14. If you place an implant in the lingual root, you actually slice a finger of keratinized tissue from the buccal or of that tooth, wrap it around the implant, then you've got the implant with keratinized tissue around it. And then the tissue punch, of course, is kind of like a cookie cutter technique. This is another X-ray. This procedure was completed in about 20 minutes. It was basically 3 implants with an impression. It was flapless. I used a shorter implant, and it was a 3-in-1 type implant, like I just mentioned earlier. And those 3 crowns were actually cemented on 30 days later. Total chair time was only 1 hour and 15 minutes for that procedure on the upper left. And so anyway, this is stuff that you can do in your general practice. Now this same patient wants to replace one of those bridges with, I guess, the distal abutment on the lower left, number 18, is getting decay under there. So he wants to do more implants because that was so easy for him. This next case features upper NoDrill implants. This patient needed an upper implant retained denture. There's the 4 implants up there, done entirely without a drill. As you can see, the base of the implant, or the apex of the implant, is shaped in such a way that it actually does a mini sinus bump if you need to do that, like on site number 4 there. And so anyway, if you want to do the prerequisite to the implants, you can go to this event. I'll be speaking for 2 separate days there, 1.5 hours each session. I'll be going over all these techniques and how to immediately implement them in your practice. I actually am the founder of OsteoCore Dental Implants also. If you want to look at that website, go to www.osteocoredentalimplants.com. That's OSTEOCORE dentalimplants.com. But basically, this Dallas event here, August 2nd through the 4th, is the prerequisite to my 2-day training. So if you go to this event, you'll be given a discount because you're on this webinar today, and you'll be able to see me there presenting all the techniques that I just went over. But more importantly, watching Chris teach you guys how to, increase your practice by, well, for me it was about 2-fold, almost doubled our practice with his techniques. But even if you get a 50% growth with Chris's techniques, that investment of 3 days in Dallas, I tell you what, it will not be a waste of time. So Chris, can you tell us more about how these folks can register and kind of what discount you're offering them today for being on the webinar?
No, I was really proud that we could get Brady to come because he was willing to teach his prerequisite course there, which is something that normally folks would have to go through before they could even advance in his training anyway. And when I set this summit up, my main objective was I wanted to make sure that when someone came and left, that they had all the tools that they needed to at least get started and get some good things going as far as the strengthening the practices and guarding against the dangers that are coming down the pike, And so I'm going to be teaching a lot of my systems. I'm actually speaking like 4 times, and Brady's speaking on a couple of different days with his prerequisite course. And we've also brought in a bunch more speakers that every one of them has a story to tell and some tips and techniques that they've used to strengthen their practice. I'm going to tell you what, guys, the doctors that will be coming there have got some amazing practices. Some of these doctors are famous, some are not. Some doctors have never even shared on stage before what they've done, and I talked one guy into coming that's never spoken before, but has maybe the highest producing practice in America that I know as far as general dentistry, and considering their fees, which Brady said I did real good at that, this guy does a little bit better than I do. So, and we also had a full day dedicated to attracting new patients. So I think that's another thing people are always wondering about. How can I get more new patients? So I set aside a full day, and that's all we're going to talk about on that day is how to get more new patients. So that's our event. You know, he gave the website. It's biggestbaddestdentalevent.com is where you go, and you'll be able to get a discount there. I think if you decide to do monthly payments, it's going to be like $366 a month for the next 3 months. You're guaranteed 15 hours of CE. I'm going to try to squeeze in another hour or two if I can. But considering what this summit would do for you and the cost of CE, is just a totally minimal investment. So I sure hope that we could see you there. And phone number there to call if you can't go to the website is 662-837-8143. Either of those ways, we'll get somebody to get you signed up, and we'll be looking forward to seeing you there. So I don't know. We had a pretty good talk today. Jeff, did we get any questions, or what do we need to do next?
Yeah, there were a few questions that came in, and I'll go ahead and pass these on to you. One of the questions that I feel was asked once, this one came in one time, that I understand that it's time for implants, but I'm still nervous to move forward. Any suggestions? I would assume that this goes to Dr. Frank.
Yeah, that's what most folks feel like before they ever place implants. After going to the prerequisite course in Dallas, if you do decide to come to my 2-day training, I do that once a month. It's a mini residency on efficient implants for the general dentist. I call it the Implant Efficiency Institute. Currently, we have a 100% success rate of dentists going back to their practice and doing implants. And I get emails every week from guys who've placed their first ones. And so most dentists are still kind of, their knees are shaking before their first implants, and that's okay. Anything new, has that in it. But I'll tell you what, after they get used to placing a few cases, and I'm with them through that whole process, things get easier, and pretty soon they're helping a ton of patients out doing implants, because I follow 2 rules, the 6-millimeter rule with the nerve. So I never, you always want to stay 6 millimeters from the nerve, because even if you do make a 3-millimeter mistake, well, you're still fine. And then also with the sinuses, we don't do any bone grafting in the sinuses. So I teach 100% no bone grafting, no suture, general dentistry implants. And once you understand, hey, this is easy stuff, success rates are great, and if an implant fails, you just unscrew it, let it heal, and do another one a few months later. And it's very rare that you have to do that anymore with new technologies and implants. Folks find that there's no reason to be scared of implants. Most people are, scared to death of implants because they were taught by an oral surgeon. And that is scary stuff. I mean, you're ripping somebody's mouth apart, half the time. Not figuratively, but I mean, you're doing major flaps, and that is scary for a general dentist. So this is a totally different way. This is new school implants. It's how the best practices today are doing it, and so no reason to be scared today on that. But most folks are a little nervous.
I like that. New school implant. You should have named your
new
company
school
that,
implant,
Brady. He's true. It is true. He is a great hand holder, because nobody was more scared to place an implant than me. And if I could put in whatever it was, 13 or 14 in a day, I'm pretty sure anybody out there can do it with his teaching. Okay, so I'll give you that plug right there.
Thanks, Chris.
Great. I'll go ahead and pass along one more question. This is combined from about 2 or 3 questions that came in. These 3 questions pertained to the changes that need to take place in an office. I assume that this is for Dr. Griffin here, how did your staff react to these changes, and how did you ease these changes in so that they were well received?
Yeah, so I guess they're thinking, we do things a certain way, and golly, we'd like to do more same-day dentistry. Maybe we'd like to do implants, whatever it is. But, gosh, the staff just really, they don't want to change, and I don't know that I'm the leader to make them change. That's a good question, because everybody, hey, staff, they don't always want to change. What I think you have to do is you have to show the staff why this is going to be better for them. We're always a big proponent of rewarding people once they've done a good job and implemented something new. We think that's important. I think if nothing else, besides the money aspect for a staff person, what they don't realize at first sometimes is how much easier their life's going to be. Because guess what? When they know what their job is and they do their job correctly and they're rewarded for that, their life's a whole lot better than when things are hectic and chaotic and the doctor's upset because the practice can't grow and stuff like that.
Hey, say that one more time, Chris.
I was just saying, I think the staff, once they realize how much better their life can be once the systems are down pat, I think that's a big deal. I think a lot of times the staff maybe doesn't understand that, and the doctor, we just need to have a good conversation with them and tell them, hey, we're going to do this new way. It's going to be great. And trust me, when you look back in a few months, we're going to talk about it again. And these are the things we've changed, and this is why our practice is better.
Absolutely, and I'll tell you what, it was not hard to integrate your systems in my practice 4 years ago. In fact, it was refreshing for staff to actually know what was expected of them, and when they knew what was expected with them, it was easy to track, and our production went through the roof. And it wasn't a hard transition. We just needed to know what to do, especially with the same-day dentistry, and it worked out awesome. So, Jeff, I know we're at the end of our time, and so I really appreciate you putting this on today, Jeff.
Yeah, well, we're happy to do this. Of course, DCEdental is always looking to make sure that everybody stays on the cutting edge of everything. So, doctors, we appreciate your input and your service here today. That's it. We'll go ahead and close up. Thanks for coming, everybody, and we look forward to having you more often on DCEdental. Thanks, guys.
Thank you, Jeff. Thanks, Brady.
Thanks, guys. Have a great day.
All right, you too.
Bye-bye.